Hello students, my name is Irzan. I'm a lecturer at the Department of Family Medicine. So it's very nice to see you again on today's lecture. So today's lecture topic is end of life care. It's a really important topic of the medical doctors. Also, it's really important for everyone who's near with the medical stuff. So, okay, please go to the what is the end of life care mean? So the end of life care that's usually talk about the physical, psychosocial needs for the person and their family. And please focus on physical as well as psychosocial needs, not only for the body. End of life care take attention for the social wellness of the person. That's really important. And also the next thing is that they really gives a care for the family members. It's really important thing of the end of life care. So what about the goals? The first one is we need to make comfort zone for the person who is near to die. We need to support. We give a support. We give a favor. We give a help. And also we need to give comfort care for the person who's going to die. And number 2, what are the goals of end of life care? We really focus on patients' quality of care, quality of life. Quality of life is really important because it's really important for each person. Also, it's very different from person to another. In number 3, what are the goals? We need to make dignified death for each person. We try to make them how to dignify death. It's very difficult. It takes a time how to make a dignified death. And when it's occurred, might be easier to go away, to pass down, to die maybe. So dignified death is one of the goals of end of life care. So what does the death mean? That's obviously irreversible process of circulatory, respiratory, and the brain. That's an irreversible process of the most vital organs. So what kind of changes have been occurred during dying process? For example, in a sight, it would be blurred. How about the sound? Slightly decreased. What about the taste? Of course, sensation of taste would be decreased. How about the smell? Smell would be nearly decreased. It depends on the person. So how about the touch? Touch would be slightly decreased. Okay, how about the balance in the person near to die? Would be imbalanced, would be decreased, would be unstable. How about the body position? It would be stable. And how about the tactiles? Tactiles is changed. It's because of the sensory issue. So how about the sensory system? Hearing. Usually the last to go. Okay, touch, decreased sensation and perception of pain or touch. Taste and smell, decrease with the disease progression. About the vision, blurred of vision or glazing of eyes, blink reflex absent, and also eyelids remain half open. It's very obvious. Eyelids remain half open, as usually happens before death. How about integumentary system? The obvious sign is that cyanosis on nose, nail beds, and knees. That's really obvious. And also cold, clammy skin, mottling on extremities. That can be happen. And also for respiratory system, that's so many breathing could be occurred before death. For example, increased respiratory rate, tachypnea. In Cheyne-Stokes breathing, that's the main obvious common occurred breathing before death. It's a very obvious, so everyone who would gonna be a medical doctor, they need to know about the breathing. It's very characteristic sign before death. So it might be so if you would like to know about the Cheyne-Stokes breathing, there's so many sources on internet. You can search on the internet and you can listen how about the breathing goes on the Cheyne-Stokes. You can search it. Okay, what about other changes? Inability to cough. It's really important in palliative care, and really important in end-of-life care. They cannot coughing. So that's why the secretion the mucus cannot remove. And that's causing gurgling or nasal congested breathing. Congested. That kind of sounds really happens before that. Okay, the next one is irregular breathing. Gradually slowing down to terminal gas. Might be the same breathing happens before death. Also, there's all kind of cosmo and also bite and so many pattern of breathing. You can search and you can learn from the internet and how this goes on. Okay, that's the change on respiratory system. How about urinary system? Gradual decrease in UOP. Well, okay, UOP in medical term, what does this abbreviation mean? What do you think, my students? UOP. Okay, that's a urine output. That's right, urine output. Really good. So decreased urine output is one of the common signs before death. And also incontinent of urine or unable to urinate. And that's why we put the catheters on the patient before death. Okay, what else happens? From the GI tract, gastrointestinal system, slowing of GI tract, possible cessation. It might be from the lot of pain prescription. For example, there's a pain relievers gives over-the-counter pain relievers gives for the patients. Also accumulation of gas, distension and nausea, or some kind of vomiting can be happen. Incontinence due to loss of sphincter control and bowel movement. BM, that's mean in GI system. Bowel movement may occur before imminent death or at the time of death. Okay, that's a change usually happens before death in the GI tract. How about the musculoskeletal system? Gradual loss of ability to move. Sagging of jaw resulting from loss of facial muscle tone. Swallowing can become more difficult. And sometimes it's kind of a noise can be happen before the cannot swallow. This kind of barrier on the tongue, cannot swallow all those. It's because of the result. It's because of the smooth muscle cells cannot tighten. It's because of that. The next thing is that difficulty maintaining body posture. And also the main characteristic sign is that loss of gag reflex. It's really important. And also for the patient on large doses of pain medication, for example, usually opioids might see jerking. Okay, that's what happens in musculoskeletal system. One of the vital organs, for example, cardiovascular system, the really common sign is that increased heart rate, tachycardias, and also other irregular rhythms happens before death. And also there could be decreased blood pressure before death. And for the dying process, what do we need to make a comfort zone for the patient? We usually give the cards. There on the cards there's a wishes. We made an article, we made a research study, and what kind of wishes before death do usually person think? It depends on the nationality. It depends on the person. Also, it might be depend on the gender. And we will give those cards for the patient. Just with the 5 of them, just take one of the most important one. And that kind of give them at least five wishes we can take from those all 30s. And then we try to fulfill those wishes before them. It really calms down the patient. It really gives them comfort. It really gives them not worry before after die. It gives them so much comfort, so much. It gives them might be dignified death. So how about that? Talk. There are some things may not want to discuss with the family. The person could be talk. Express feelings. They need to be talk about the illness and what kind of feelings do they have. Please share. The person needs to share deep feelings. What inside in the mind they are really think. And then share worries and concerns. That's really important thing. Every person, they have really concerns. They really worries for their family, for their kids. Really worries. They need the person is going to die. Need to share about that. And just be there. That's mean don't feel you need to talk. And sometimes silence is okay. Because of before the death, this person is really exhausted. So we need to be forced. We need to be give time. We need to be patient. If the person is not talking, that's okay. And also, who touch is really important. And also, personal attitude about that will influence the patient. And also, if there's kind of abnormal signs happens, you need to tell to the nurse. And there's only a question that how do we know the date of death? If you would like to know about the date of death, that means when will the person would be die? It's a really important question, and you can, when you would like to know about the death date, you can use Karnofsky index. Okay, also we need to care for the patient family. Also, the family is really gives concern, challenge, obstacles. So we need to talk, express feelings, share worries and concern about away from the dying patient. The family members may be require a private area to talk and make decisions. The focus is often on the patient. They often neglect their own needs. May need to get them pillows, blankets, or a place to sleep, meals, and chaplains. So I have a question for my students. What does the chaplain mean? What do you think? Okay, chaplain is mean of help of the religious members' religion. For example, there's a Christian popes and lamas, which gives spiritual support for the patient. And then report anything significant said by the family to the nurse. What kind of changes you would observe? Please tell it to the nurse. Okay, what kind of service available? I think my students always have already known about the palliative care. Everybody knew about the palliative care, because in the previous lecture I have been told that from curative care usually goes in palliative care. Do not the recovering of the process, but just take care, just ease down the symptoms. That's the palliative care. Those palliative care usually gives on hospice care, in hospices, provides compassion, support for the dying person and the family. And also there is home health and also chaplains. So hospice care involves team-oriented approach from expert medical care. There's so many experts, so many professions, for example, dietitian, psychologists, chaplains, and physiotherapy, and so many professions may be included in this team. Pain management, emotional, spiritual support, and that would be tailored to patient's needs and wishes. Support is provided to the patient's loved one as well. Do you know that the people with a lot of kids, they tend to love just one of them. They have a responsibility, they have a right to take one's loved kids' care. They have a kind of right. So we need to focus on that. We need to be flexible on that. At the center of hospice and palliative care is belief that each of us has a right to die pain-free and with dignity, and that our families will receive the necessary support to allow us or to do so. So please focus on this picture. So on this core thing is a terminally ill patient. So how about surrounding from the patient? Of course, friends, and of course, families. So we need to worry about all those patients as well as families and friends. So once I told that there's a team management, team care would be gives for the patient. So it consists of medical director, medical doctors. Also, it will include social worker, complementary therapist. Nowadays, it's very common. Spiritual care coordinator, volunteers, home health aides, RNAs, registered nursing. Those team members are developing the whole health care for the end of life care. So what is continuing medical assistant? Comfort measures. What do we think comfort? Usually patients, from 85% of patients, they really care about the pain management. They don't like to feel any pain before death. We need to focus on that. So we will, in order to know about the before death care, you need to know about the pain management. Also, the bathing is really important. The person near to die, we need to bath every day with the good aroma and with the good smell. It's really important. Also, position of the body, position of the patient. We need to change position every 2 hours, preventing from other complications. And also we would just think about the music. Music therapy is really common. Every person really comes down with the good music. And also touch is really important. Hold a hand, gentle massage on the body, and hand on visitor's shoulder. This really gives warm attitude towards the patient. And also the patient in palliative and end of life care needs religious needs. Visit from the chaplain, reading a scripture, and also with the visitors who is the terminally ill, we need to give snacks, drinks, also supportive presence, non-aggressive medical treatment. That's what I need. What is needed for the comfort zone for the dying person. So how about the continued medical assistant number 2? What about the skill? Provide comfort measures for the person at the end of life or on hospice care. So please focus on the hospice care. Hospice care is the place to give a quality of life, gives a good quality of life on the patient before death. It's not a place to die. It gives a more comfort, more reliable, more evidence-based care for the patient. And what about the continuing medical assistant health number 2? What kind of skill? Removal of non-surgical inserted tubes. So many patients do not like tubes at all. For example, respiratory distress syndrome, obviously in the COVID-19, there were so many cases I've seen on the patients. The most often they don't like to insert tubes. They would like to remove of their tubes. So from the person is needed, we need to remove all those tubes, because there's a rule is that we do not need to stop the dying process, because it's a physiological process. We need to remove all the devices, all the devices from the person after die. So post-mortem care begins when the person is pronounced dead. Maintain privacy, treat with dignity, done to maintain good appearance of the body. For nowadays in Mongolia, also as well as in other countries, there's a kind of might be of some of the lobby groups, some of the business group, one of the companies are doing these things. For example, there's this coloring of the skin. They're kind of making makeups on the cadavers, on post-mortem person. and bathing patient is needed, and also their care of the position of the body, and their care about the stiffness. Stiffness is really occurs after death, between 2 hours. Stiffing, just laying down on the stable area, and removal of nerve surgery and surgery tubes or devices under direction of nurses. Some patients have to be cleared by the medical examiner, not to have tubes or enteral cleared. So after that, we would talk with the family members about the death and how what goes on, and how to make final kind of service for the patients. So really it's important. It's also needed for every medical doctors, because every person, there's a tendency is that the person once burned, then one day they would die. So dying process needs to be some comfort. So that's why the end-of-life care branch of science is occurred. And thank you for my students that listening this topic, this lecture. See you soon on the next lecture.